Hi, welcome. My name is Desmond Onukwa. I'm a student pharmacist at University of Charleston School of Pharmacy. How may I help you?
Well, today I just have a question. So I'm having minor pain and aches in my muscles and joints. I'm hoping to pick up some medication that would help relieve these pains and aches, but I do not really know what medication I need. There's just so many choices out there.
I'm so sorry you're not feeling well. Please, would you allow me to provide you with some information regarding the appropriate medication for ache, pains of muscles and joints?
Absolutely. Thank you so much for offering your help.
Could you spare like 7 to 10 minutes so that I can go over the appropriate medication that I think will help relieve your muscle and joint aches and pains?
Sure, I can spare 7 to 10 minutes so that you can explain to me about which one's the right medication to take. Absolutely.
Now, before we start, is this medication for you or for someone else?
Yeah, this medication is for me.
Okay, great. What symptoms do you have?
Well, I have this pain sensation in my muscle and joints, and last night I felt really like tearing and rupturing pain in my ligament, tendon, and muscle. I took some acetaminophen since the symptoms of inflammation was not involved to see if the aches and pains will subside. So I didn't take any Advil. Last night the pains and aches just became mild and moderate level pains.
Oh, I'm so sorry. You are going through moderate pain and aches. I'm so sorry you're going through moderate pain and aches. From scale of 1 to 10, could you describe the extent of the pain? Is it sharp pain or an ache?
It's definitely more of an ache. On a pain scale, I would think it's like 5.
Okay. When was the last time you have muscle or skin discomfort?
The last time I had it was a long while ago after taking acetaminophen and taking it during bedtime. Then I felt relieved.
When did it start?
When did it start? It started about 4 days ago after mowing the grass in the front of my house, mowing the lawn, basically.
Can you describe to me the areas of your body that you feel the pain and the ache most?
I feel most of my pains and aches in my joints, muscle, and thigh area.
What are the things that make the ache and pain worse?
Since I finished mowing grass in my house about 4 days ago, I felt a sharp pain and ache whenever I run the treadmill in the gym or just daily exercise.
What are the things you have tried that made the pain or ache better?
My friend who is a first-year pharmacy student suggested to me to apply the rice therapy that it will help alleviate my aches and pains. I tried therapy, but it did not help really.
What self-care exclusion criteria of musculoskeletal disorder are you aware of?
I'm not sure what that self-care even means.
Self-care exclusion criteria simply means those severe symptoms that only your physician or primary care provider is allowed to treat, such as pelvic or abdominal pain, pain that lasts more than 7 days with treatment, or pain that lasts more than 10 days regardless of treatment, intensity of the pain or ache, and pregnancy.
All right. Oh yeah, I see. Okay.
From my assessment, you did not meet self-care exclusion criteria. That means you can be effectively be treated, with OTC medication.
Mm-hmm.
What prescription or non-prescription medication are you currently taking?
I'm currently taking acetaminophen. That's it.
What allergies to medication do you have that you're aware of?
I don't think I have any allergies at all.
What medical conditions do you feel you have that might be a contributing factor to the aches and pains?
None. I think I'm pretty healthy.
Okay. I have a thought about a medication that can potentially be used. Would you mind following a medication regimen for 4 days?
Yeah, absolutely. If it makes me feel better, I definitely would follow the regimen for 4 days.
The medication that I think will be best for you is this one that I have right here.
Mm-hmm.
It's called capsaicin. Are you familiar with this medication?
No, I never heard of that before.
Based on the information you gave me, I think it would be best to go with capsicum oleoresin, 0.025 to 0.25%, which is a brand of capsaicin that will irritate without redness to help reduce some of the pains and aches without side effect of inflammation.
Oh, that would be fantastic. Great.
You are going to be using this medication regularly. If you are using the cream, gel, liquid, or lotion formulation, apply only a thin film to the affected areas of your body 3 to 4 times daily. For the patch, 0.025% formulation, apply 1 patch to affected area of your body for up to 8 hours, maximum of 4 patches per day.
That sounds simple enough, so I just apply it to the affected area. I got it.
There may be common adverse effects associated with capsaicin. They include abnormal skin odor, burning sensation of skin, cough, dizziness, headache, etc. Do not be too alarmed when you experience these adverse effects, as long as it is not severe. But if they become severe, call your physician immediately.
Oh, okay. No. So is there anything bad that will happen to me when I take this?
There is a possibility of rare but serious adverse effects to this medication. They include peripheral sensory neuropathy, hypostasia, peripheral edema, throat irritation, etc.
That does not sound too bad, but because those in the commercials on TV usually say you can die from the result of the adverse effects, so that's great.
I understand your concern, but all medications have the potential to cause side effects, and while most people do not have any issues, it is important to understand of certain symptoms. Bear in mind that capsaicin may cause allergic reactions such as burning, itching, difficult breathing or swallowing, blistering, etc. Also, if you have any severe muscle and joint pain, call your doctor right away. It is important to know that you should only use this medication for 3 to 4 days. After that, you would need to contact your primary care provider.
Okay, thank you for informing me. Hopefully I won't have any of those problems.
Great. There are no known significant drug and drug-disease interactions. Also, this medication won't interfere with your allergy medication, so you can continue taking it as needed.
Okay, great. I'm glad to hear that.
Do not use capsaicin for acute pain. This is because painful relief is usually experienced within 14 days, but may be delayed up to 6 weeks. Avoid taking overdose because it may result in neurotoxicity and hyperalgesia.
Okay, thanks. I'll bear that in mind when I'm taking capsaicin.
Now that I have told you how to take this medication, it is important to know that if you miss a dose, you should not double up doses. Rather, you should continue on the next dose as scheduled.
Okay, I'm glad you mentioned that because I may have doubled the dose whenever I miss a dose. So now that you told me not to do that, I will definitely refrain from doing it.
That's very good to hear. You also want to make sure that you store this medication at room temperature, protect it from light and heat. Also make sure that it's safe, it's in a safe place, away from pets and children.
Okay, that's great. I can manage that.
Apart from the rice therapy, what other non-pharmacological therapy did you apply?
I only ever applied rice therapy.
You might want to combine the rice therapy with capsaicin application on your joints, muscles, and thigh. That would likely produce a more effective result.
Oh, really? I would definitely give that a try.
So now that we have gone through a lot of information, I'm going to give you this sheet that talks about the medicine, but I want to make sure you understand how to take this and what to do if it's not working. Can you repeat to me the instructions I gave you so I know you know what to do?
Absolutely, I will. If using a cream, gel, or lotion, I should apply a thin layer 3 to 4 times a day to the affected body area. For the 0.025% patches, I would apply 1 patch to affected body areas for up to 8 hours, maximum 4 patches per day. Keep track of the symptoms and seek medical attention if there is no improvement within that 14 days.
Yes, perfect. And if you have any questions about this at all, don't hesitate to call me before then.
Awesome, thank you so much for your help. I don't know what I would have done without your help. Thank you.
Of course, have a great day.
Yep, you too, thank you.